Hello everyone, I'm Dr. Iyantha. So today I thought to talk about the general structure that you need to use when you're dealing with Plab 2 exam. So this is mainly for the history taking scenarios and medicine type of scenarios. Okay, so let's begin. So when you enter the cubicle, there will be a patient and you need to introduce yourself and you need to confirm the identity of your patient. That means your patient's name as well as the patient's age. Once you have done this, you come to the most important thing, that is the presenting complaint of your patient. So the golden 1 minute comes in your data gathering. You need to listen to your patient, always give an open question. Let your patient talk. Don't start with closed questions. So always try to get the information from your patient. Can you tell me more about this complaint? And you get information regarding the presenting complaint. So if your patient is having a pain, try to analyze it using Socrates mnemonic. That is, site of the pain, onset of the pain, character and radiation, anything that makes it better, timing of the pain, anything that makes it worse, which is exacerbation, and a pain scale. If it is not a pain and something else, use the mnemonic Odipara. O, onset, D for duration, I for intensity, P for progression, A for anything that makes it worse, and R for relieving, and A for anything else. So when you ask these mnemonics, you get a better understanding regarding the symptom. But generally, if your patient tells you things in the presenting complaint and whatever the missing, only you are going to ask from your patient. You are not going to repeat the whole Socrates or Odipara, but whatever that is not said from your patient, you have to ask. And you have to ask any related symptoms. And also, if there's any trigger for this, as well as you need to ask about the differential diagnosis. So, few differentials will be adequate. So, once you get a proper understanding about the presenting complaint, also try to exclude the red flags. Once the presenting complaint is done, then you need to focus on the general history taking. You need to ask if your patient had ever had a similar symptom like this in the past, and about the past medical or surgical or whatever the gynecological and obstetric history your patient is having. Then about the medication history, any allergies, and about the family history. So optionally, you can ask about the smoking, alcohol, recreational drugs, and about the diet and exercise of your patient. Also about the sexual life, occupational history, as well as travel history. If this is a female patient, try to ask about the periods, then whether she's using any contraceptive pills or whether she's pregnant, as well as whether she had undergone a pap smear if she is more than 25 years of age. So this gives you a good understanding about the general history. Then you need to ask about the impact from that symptom to the patient's life, the psychosocial aspect of the patient, work and about home life and what type of support your patient has. And always do not forget to ask the concerns. So once you analyze your symptoms well, ask about the eyes, also idea, concern, expectation. So when you are focusing on examination, try to use simple language, verbalize your examination. You need to say that you would like to take the observation of your patient as well as the relevant examination. So once your patient had given you the history and you have got the results of the relevant examination you mentioned, you can analyze and come to a diagnosis. So you need to mention your diagnosis to your patient. And once you mention the diagnosis, always use simple language to explain the diagnosis to your patient. Then ask whether your patient have any questions. Give your patient time to ask questions. And if the patient had got any questions or any concern, you need to respond to it. And then the most other important part, you need to focus about the management. So when you're talking about the management, you should have a good outline of your management. You need to mention about the particular investigations you're going to do, and these investigations can be investigations done to confirm the diagnosis and whatever the for the next management. So you use simple language when you are discussing about these investigations. Then give options to your patient regarding medical management, non-medical management, and get their view. And whatever the option they select, answer that accordingly. Mention about your seniors and always have a follow-up plan for your patient. So also you can mention about leaflets, then any questions your patient have, always reassess his knowledge and try to respond. Finally, when you are ending your consultation, you need to safety net your patient regarding the red flags of that particular symptom, as well as about the lines of help and whatever need the patient need, you need to provide all those information. And thank your patient finally before ending the consultation. So this is it, a basic guide for you when you're taking your history taking. I hope this video will be useful to you. I will get back to you with many more videos of Plab 2.